with us Dr. Balasubramanya, who is a senior consultant and HOD periodontics. Welcome, sir.
Thank you.
Today, we will be discussing about gingival bleeding and bad breath, gingival or gum bleeding. So, could you please give us an insight about this topic?
Basically the overall the dental hygiene is very important at the day-to-day practice. That's the first thing. The people is always give the last priority for the particular gum disease, including the oral health. So if the person is unable to manage the oral hygiene from the day one, so that particular point of time usually will see the dental problems, which include the cavities and include the bleeding gum and include the bad breath, all these things. The journey will start. The journey you want to give the break, then we have to treat the particular address the issues. That time we have to visit to the dentist to explore regarding the dental problems. So in this manner, how we can able to address the problem once the patient visit to the dentist.
Okay, so here are a few questions, sir, from our viewers. What could be the underlying causes of my gingival bleeding and bad breath?
Okay, it's a good question. What usually in the public forum is asked this question. The gingival bleeding is basically it happens because of lack of hygiene, oral hygiene.
Okay.
That is called the plaque. Whenever the residue of the food particle which is left over in the oral cavity, that time the bacteria usually will form in the top of the food particle. So there usually it will form the particular gingival get swelling and inflammation.
Okay.
Then you'll see the bleeding. So this is called the gingival bleeding. Coming to the bad breath. Bad breath is a big topic. So it's a vast subject. First thing is the bad breath because of we'll divide into the three categories. One is the local. Local means which include the poor oral hygiene where the food particle usually gets stuck in between the tooth area. Over the period of time, the bacteria is having the capacity to cause the bleeding comes and as well as releases the endotoxins, which is the root cause for the bad breath. Then followed by the systemic diseases, which includes the tonsils. Always, I used to get a lot of patients in the Sakra OPD for the patients having the bad breath, and we check the tonsils. Usually, patients have the tonsillar crypts. On that behalf, the tonsillar crypts always food particle gets stuck in the tonsils.
Okay.
That time, the patient is always having the complaining of the bad breath because of oral cavity. But when we see, we have the mirror image on the particular tonsils area. That time, we refer to the ENT department to check with tonsils to address the tonsils and for the treatment. Next, coming to the chest. Any person is having any kind of the COPD, the chronic obstructive pulmonary diseases, or any the lung infection, the long-standing infection. That also one of the mirror image for the bad breath. Coming to the intestinal issue. Intestinal issue is the one that mainly for the mirror image. Mirror image which include the indigestion system and where the constipation and the patient is having the chronic alcohol or the long-standing diabetic patient. That also one of the reason for the bad breath. So we have considered these two, and main thing is the one is the pseudo. Patient doesn't have any kind of bad breath. They feel like it's a bad breath.
Okay.
That particular point of time, the patient, if visit to the local the dentist, visit to the dentist, that time we need to give the awareness to the patient. Patient doesn't have any bad breath. Usually 12 hours is maximum the oral cavity can able to withstand the particular the bad breath. Beyond it, definitely morning and night brushing is compulsory for each and every person. So on that behalf, we are considering the category of the bad breath and the gingivitis, where they keep the brush morning and night, the oral cavity, to keep the dentist away.
So, as children, our parents would always say, brush in the morning, brush while sleeping, and then drink more water. Keep your digestive system well so that you don't have bad breath problems. Are there any specific dental or oral health conditions that may be contributing to these symptoms?
Any symptoms which include, once the journey starts, so there is no any kind of end for the journey. In terms of, suppose if a cavity starts, so the cavities keep on recurring in all the other oral cavity, which lead to food particle gets stuck. So that time we need to identify that cavity, we have to fill it to make sure that any kind of the presence of food particle should not be there in the oral cavity, means any hidden spots. On that behalf, this will can able to prevent the further follow.
What steps can we take to prevent gingival bleeding and improve my oral hygiene?
Simple brushing habits. Morning and night, See, one thing is what will happen. There are a couple of doubts usually happen in this particular normal, especially in engaged group. Everyone will work from morning till evening, and evening will have the exhaust or exertion. They don't have energy to go to the restroom and do the brushing. So on that behalf, what will happen? Ultimately, the lack of hygiene at the night, which accumulating of the plaque or the calculus keep on accumulating, which lead to the form the gum disease for sure in the future. On that behalf, so the basic tool is the brushing, morning and night. And second thing is usually people forget to change the brush for your kind information. Majority of the people always they'll do the brushing, they'll forget to change the brush. Any brush lifespan is around 3 months. Beyond 3 months, you should change the brush. Otherwise, the physical property of the brush will always be the lesser. The efficiency of removal of the plaque is not so efficient. So on that behalf, now the present world is motorized brushes available.
Correct.
Let them utilize in the motorized brushes available over B2 Series Pro, 3000 Series Pro, and the Cure Pro Sense. Many sonic brushes are available. You can pick it up and make sure that keep the hygiene neat and clean.
True. Are there any lifestyle changes we should make to help alleviate these symptoms?
Lifestyle in terms of the junk foods and the artificial beverages, Coke, thumbs up, all these things what will happen. These are all acidic nature of this the food beverages, which include, and one more thing is, if you see nowadays the present trend is the healthy, the people is always having the tendency to use the hot water with lemon in the early morning hours. This is good for the body, it's acidic nature. Ultimately, what will happen at the over the period of time, enamels got start eroding and form the severe sensitivity. That is also one of the, of course, it's not related to the gingivitis, but this is one small tip for the patients who really, they should, while drinking any kind of lemon juices, they should take through the throat and make sure they should not touch the enamel, should avoid it. Otherwise, enamel which lead to, of course, everyone wants to reduce their weight. For that to balance the acidic nature, they will take the particular healthy food and beverages like thumbs up, Coke. Just day before yesterday, one patient came with the multiple cavities. Those are having the habit of taking Coke since past 4 years.
Okay.
There's the one thing where I can able to address it. So healthy food and the healthy diet is always keeps the gums will be keep into the good healthy stages along with the brushing.
Are there any specific dental care products or techniques we should be using, such as toothpaste or mouthwash?
See, the toothpaste is really welcome. So whatever the paste is, of course, there is a lot of debate with fluoride toothpaste, without fluoride toothpaste. That is the one aspect. Second aspect is the one, the paste is must for the brushing morning and night compulsorily. Now, the many pastes are available, which include the Colgate to Sensodyne to Puroprox to many brush pastes are available. So that is the one thing. That is welcome. But mouthwash, why? Mouthwash is definitely recommend if there is any kind of gingivitis is present. That once we do the deep cleaning, then only we will give the mouthwashes for 2 to 3 weeks, not beyond it.
Okay, so it's not a regular kind of. Okay.
If you use the mouthwash doesn't know which bacteria to kill, which bacteria to retain. Over the period of time, what will happen? We'll develop some other issues, and there's addiction. Mouthwash don't recommend unless and until if necessary for the demand for this particular patient. We'll recommend that to be for the short span, not for the long span. 2 weeks or 3 weeks, not my. Otherwise, if we continuously use mouthwashes, we can see the stains on the tooth surface also.
Oh, okay. Are there any specific dietary recommendations that may help improve our oral health?
As such, no any kind of the dietary improvements in terms of discipline lifestyle in terms of the.
Okay. Should we be concerned about any other potential complications related to gingival bleeding and bad breath?
Yes, this is a good question. What you see now, the potential complication related to gingival bleeding, it won't happen for the healthy people. Those who are having any kind of the patient is taking any kind of blood thinners. That time we'll see the gingival bleeding. Gingival bleeding where they have the past once that they started taking the blood thinner, Ecosprin Mini or the Ecosprin 150. So that time the patients, a lot of patients we used to see in the OPD after the particular stent placement or the bypass or whatever the cardiac stimulation surgeries, that time this trigger this existing elements. So that time we should treat the gum treatment, they can't stop the blood thinner, especially night times, especially when they lie on the patient because of the pressure, they'll see the bleeding. continuously.
Oh, okay.
So in this way, bad breath is also one of the add-on. Of course, if the bleeding, the clot will be there in the inside, what will happen? Definitely
Natural. Yes.
they will be there. So in this way, how the particular the bleeding is a major concern for those who are having systemic compromised the patients, especially those who are taking the breath in. At that time, they should address to the dental issues to make sure that gums supposed to be get clean, neat, and keep the hygiene to keep away the bleeding complication from the breath.
Are there any medications or treatments available to address these symptoms?
As such, no. We should remove this particular the plaque and the calculus deposit. This is the basic the factors which we remove this. Unless until without removing this, patient they'll try all the trial and error at the home remedies. So including they'll try first is the mouthwash and they'll try some other medications also. And now is oil pulling. Oil pulling also people will try. Of course they believe, but evidence based is not.
What
much.
is oil pulling?
Usually they'll put the oil in the mouth and they used to do the oil rinse. So that will keep
Oh.
yeah. But evidence based is not really up to the mark. But in medical in the field in the segment, if you go, they need to treat. In the dental only, if you keep the hygiene in terms of this, which I told you the previous question which I answered to that. The disciplined lifestyle, including the brushing, keep the dentist away. One apple per day, it will keep the
Keep the doctor away.
away. Same way, how this particular this oil pulling, all these things is the one the basic thing for the patient imagination. But you should remove the etiological factor, which are plaque and the calculus. In that way, how they keep avoid the gingivitis.
How frequently we should schedule our dental checkup and cleaning to monitor and manage these conditions?
6 months once. 6 months once, and see whatever we see in our body, in whole cavity, we can't see by ourselves. We have to monitor. That's what usually whenever the patient comes to the Sakra OPD, we'll have the intraoral camera. Intraoral camera is the one that basically we will show to the patient, will educate the patient how much amount of the dirt and deposit will be present in the oral cavity. In that we have this particular the etiological factor. Once we remove this, so that 6 months once, so that ultimately the residual deposits it won't irritate further damage is not going to.
Are there any signs or symptoms that would warrant immediate medical attention or visit to a specialist?
See, this is not really patient. This is what, see, majority of the people always be happy with this the particular their lifestyle. If they see the bleeding while eating the apple or banana or while brushing, they'll think that is normal. This is normal. They'll see it sometimes the bleeding will come, so they'll think that is a normal. ಏನು ಅನ್ಕೋತಾರೆ ಅಂದ್ರೆ ಅದು ಹಲ್ಲಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಬರುತ್ತೆ ಹೋಗ್ಲಿ ಬಿಡು ನಾಳೆ ಹೋಗೋಣ ನಾಡಿದ್ದು ಹೋಗೋಣ ಆಮೇಲೆ ನೋಡೋಣ. This is called, I can't say, the negligency or the awareness. This is the most important thing, especially those who are residing in the metropolitan cities like the Bangalore. So they should address it. Of course, really difficult to approach to the dentist. It's not so easy. But in this particular the present lifestyle and scenario, so they should visit to the dentist.
Bleeding gums, is it age specific?
What specific?
Age specific.
Age specific, yeah. See, bleeding gum is the one where usually happen in any age, including pediatric to the mid-age to the adult to the adolescents to the elderly. There is no any kind of very simple plaque will be there. There is no any kind of restriction for any age. You will come at any age if the person won't be able to brush properly. Even including myself, you, madam. If you won't brush properly for 1 month, what will happen? You see next after 1 month after starting seeing the bleeding. So any age we should keep the hygiene so to avoid the bleeding types.
And what happens if gingival bleeding is not treated?
Really good question. See, what happens initial stages, the gingival bleeding is always be significantly will present in the oral cavity. They will think that is normal, or they will think that it will. Some of the people have to want to address to the dentist. They don't have time. These are the two things. If you leave this treatment, the particular condition, next will go to the periodontitis or pyorrhea. Pyorrhea is the most commonly it has happened this particular disease where the bone loss. Gingiva is the gums or vasudu in Kannada or masuda in Hindi, right? So this is the particularly the covering the pink gums in the outer surface. The inner surface where is present is a bone. Just these two foundation for the to withstand root of the tooth. Once this gums is not going to treat, then we go to the below the structure of the bone, eventually the bone losses happen. That time, the lifespan of the tooth is keep on decreasing. We need to address this particular deposit at the initial phase, or else we should address a little bit more deeper. That time we should do kind of flap surgery, or indirect technique is called root planning, curettage, or we can do lasers. This is a recent diagnostics. And to clear the bacterial colony, which is the root cause for this particular disease.
So, how to distinguish between a healthy gingiva and a disease gingiva?
Yeah, this is a good question. What you ask. See, nobody knows that what is a healthy gingiva and the disease gingiva. Healthy gingiva means always be the pink in color. There's no any kind of bleeding while probing, always while eating, while brushing. Some of the people, if you ask any of the cases, majority of the people always say, "Sir, ನಾನು brush brush ಮಾಡಬೇಕಾದ್ರೆ ನನಗೆ bleeding ಬರುತ್ತೆ. ಹೊಸ brush ತಗೊಂಡ್ರೆ ನನಗೇನು ಅಪರೂಪ 3 ತಿಂಗಳು 6 ತಿಂಗಳು." These are the exemption or the common the reason from the patient side. Any point of time, bleeding should not happen. If you buy the new brush, or if you while changing the new brush, that's what I'm getting to. Otherwise, in the literature, it is to mention in the behind the brush. ಈ ಹೊಸ ಬ್ರಷ್ ತಗೋಬೇಕಾದ್ರೆ ನಿಮಗೆ ಬ್ಲೀಡಿಂಗ್ ಇರುತ್ತೆ, 2 ದಿನ ಬ್ಲೀಡಿಂಗ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ವಿಚ್ ಲಿಟ್ರೇಚರ್ ರಿಟರ್ನ್ correct now? So in this we have, so we should be aware of all this pattern of the factors.
So, is there any relationship between genetic predisposing factor for gym disease?
Yes, this particular good question what you asked. Sorry, before this healthy gingiva and the particular this one. This is always, the color is always be the red, fair red.
Okay.
That is called erythema. Gums is look like sometimes very red in color. So on that we have, if you pull your lip, if you see in the mirror, you can see first thing is you'll see the deposit. Some of the people think that there is a deposit is part of the tooth. I see many patients. They used to keep in the cover and they used to keep in the ziplock. Sir, my tooth is got chipped out.
Oh.
Actually that time when you see here, so that is actually it is a deposit.
Okay.
So on that we have. So they will think that they can't distinguish between the healthy gingiva and this particular disease gingiva. Disease gingiva is always red in color. If you touch it, sometimes it bleeds. Healthy gingiva means pale pink and neat gingiva, no deposits.
Okay. So coming to the same question.
Genetics is the one. Yeah. See, one more good question. What here you put across here, this particular today's Facebook live. See, genetics is on the basically it is the inheritance from the parent side. Usually, people will never knows that even dental problem also runs in the genetics. Yes.
Okay.
It's called the aggressive periodontitis. It's a nomenclature. Now it is removed. Now it's become that modified it. But actually, the bacterial nature is present in such a manner that the aggressiveness of nature is eaten off the bone and the gums is a matter of time. It runs in the family.
Okay.
So usually the baby boy comes from the mother predominating characters of the genetics. If the baby girl is from the father side, the father is carrying the gum disease.
Oh.
In case of the gum disease, if in case kid is missed out, next generation is passed on from the ancestors bloodline.
Okay, so it was a very informative session. With this, we come to the end of today's session. If you have any questions, you can leave it in the comment section. Our experts will revert back to you. Thank you, Dr. Balasubramanya.
Thank you.